students. So this is the second part of the lecture, which is pharmacology. And as we are discussing about introduction of pharmacology, and pharmacology is the study of the drugs, their interaction, their properties, their uses, and their effects. So moving on about pharmacology. So here in this slide, in this schematic flow sheet diagram, you can see that you have two portions. On the right hand side, it is written that pharmacokinetics, and then below, in the bottom right side, it is written pharmacodynamics. So these are being divided, the pharmacology has been divided into two portions in terms of when the patient is given a specific drug, so what is happening to the drug and what the drug is doing to the body. So first of all, in case of pharmacokinetics, dose of drug administered. So that is the important thing, that according to the condition of the patient, a specific dose of drug is administered to the patient. So then the first step is the absorption of the drug, and as the drug is being absorbed inside the body, so then the next stage is drug concentration in systemic circulation. So in systemic circulation means basically the concentration of the drug within the circulatory system, within the blood. And from there, there is the distribution factor which is coming in. So the drug is being distributed into the tissues, and another part is the drug metabolized or excreted. So once the drug has done its action within the tissues at the site of infection, so the rest of the drug, it is being eliminated, and that is referred to as the metabolization of the drug, and eventually the excretion of the drug. So that is all studied in pharmacokinetics, and basically you are dealing with the body, that how it is interacting with the drug in terms of absorption, distribution, metabolism, and elimination or excretion. And then when the drug is in the blood and it reaches to the site of action, so then the pharmacodynamics starts. So the pharmacodynamics is actually the pharmacological effect, clinical response, toxicity, efficacy. So these are all studied in pharmacodynamics. So basically, like for example, a drug is being given to treat a throat infection, and you have pain in the throat, you have cough, and you have irritation in the throat. So a specific antibiotic is given. So that antibiotic is actually killing the bacteria which are causing that throat infection. So pharmacological effect is that the patient is feeling better as he is taking the medicine. Clinical response is that if a patient had fever and after taking drug or the medicine or the antibiotic, the fever has gone down, the throat pain has gone down. So that is the clinical response. And then comes the toxicity and efficacy studies. So toxicity is that how much antibiotic or the specific drug which when given, so it reaches to a toxic level, and similarly how much antibiotic or specific drug given so that it has the maximum efficiency, it has a maximum efficacy, and it is not causing any toxicity. So all of these are studied in case of pharmacodynamics, and the mode of action is also studied in pharmacodynamics. So in the caption, you can see that it is written that the relationship between dose and effect can be separated into pharmacokinetic, that is dose concentration, and pharmacokinetic, and pharmacodynamic, that is concentration effect components. So when you are giving a patient a dose of a specific drug, so it is divided into the pharmacokinetic aspect and pharmacodynamic aspect. So concentration provides the link between pharmacokinetics and pharmacodynamics and is the focus of the target concentration approach to rational dosing. And three primary processes of pharmacokinetics are absorption, distribution, and elimination. So basically, what this flow sheet diagram is telling you is that when you are studying the drug in terms of its interaction with the body and the interaction of the body with the drug, so that is being divided into two uh, fractions or two types. One is that how the body is treating the drug or interacting with the drug, so that is dealt with in pharmacokinetics. And then how the drug is responding to the body, so that is dealt within the pharmacodynamics branch. So moving towards pharmacokinetics, so it is the description of the time course of a drug in the body encompassing absorption, distribution, metabolism, and excretion. So in the previous slide I have explained in some detail at what is pharmacokinetics, and in simplest terms it can be described as what the body does to the drug. So that is a simple like understanding or concept that what the body is doing to the drug is known as pharmacokinetics. And moving towards pharmacodynamics, so it is the study of the biochemical and physiological effects of drugs in certain period, and in brief it can be described as what the drug does to the body in terms of drug receptors, effects of drugs, responses to drugs, toxicity, and adverse effects of drugs. So biochemical and physiological effects are described as biochemical, that how the drug is interacting with the target bacteria or the part of the bacteria. And physiological effects are that when the patient is feeling better as a result of taking the drug in certain period, so it means that there is a course of every drug or antibiotic, normally for 5 days or 6 days. And in terms of what the drug is doing to the body, so there are drug receptors which attach the drug molecule and then they transport the drug to the site of infection. So those are drug receptor interactions. uh, and those receptors are present on the cellular membrane, on the wall of the cell membrane. Effects of drugs, so what are the effects of drugs, whether the patient is feeling better or is he feeling not better. Responses to the drugs, so whether the patient is feeling having a good response to the drug or the bad response to the drug. And toxicity and adverse effects of the drugs, so all these are studied in pharmacodynamics. And toxicity is that how much concentration of the drug should be given to the patient so that it is a rational dose, and if beyond that concentration, then that becomes toxic dose and causes toxic effects. And every drug has adverse effects or side effects. So sometimes like antibiotics, they cause rashes on the body, sometimes they cause fever, sometimes they cause loose motions, sometimes they cause blurred vision, sometimes they cause hallucinations. So these are all the side effects, and different drugs have different side effects. So that is all studied in terms of pharmacodynamics. So now about the drug development and approval. So if you think about drug development and approval, so it is a very long process and it takes about uh, 10 to 15 years so that the drug can be approved and utilized by the common public. So first of all is the preclinical testing, in which you have in vitro studies. So in vitro studies are laboratory based studies in which the drug is being studied at how whether it is soluble in polar solvents or non-polar solvents, what is its solubility, its precipitation, its specific gravity, and other factors. So mostly the drug which is soluble in water, that is preferred over those drugs which are mostly non-polar and they are not soluble in water. So then the reaching of the drug to the site of infection is difficult in case of those drugs which are uh, which have difficulty in solubility in water. So animal testing, so that is the second stage in preclinical testing, in which normally mice are used, and that is uh, like the mice are infected with certain infections, and then they are treated with the drug of choice, and then uh, it is seen that whether the it is uh, affecting, it is causing any difficulty, or it is um, uh, so either when you are giving the animals certain drug, so they will treat the infection, or they will further uh, have worse effects on the infection. So that is animal testing, and this in vitro study and animal testing, it takes 1 to 5 years. Then are the clinical trials. So within the clinical trials, uh, you have long-term toxicity studies. So that is being studied, that what are the toxic effects of the drugs. So in clinical trials you have three phases, that is phase 1, normal volunteers, safety pharmacokinetics. So normal volunteer means that those patients who present themselves for the study of the drug. And then phase 2, in which you have selected patients, in which the therapeutic efficacy and dose range, that is being studied. And then you have phase 3, in which large populations of selected patients are taken in, and then therapeutic efficacy, safety in double blind studies. So all of these are studied in clinical trials, and it takes about 2 to 10 years. And then you have the last phase, which is post marketing surveillance, which is the phase 4, and that is all uh, taking about 5 years. So you can see that the drug um, development is not an easy thing, and it can take a long time. So one has to be very cautious, very careful, that when you are developing a drug and taking it to market. And so the two terms which are written here is IND, which stands for investigational new drug, and then finally you have NDA, which is new drug approval. So these are the phases through which a drug has to be passed, and then finally it can be used and utilized for the patient of specific uh, infections.